Good afternoon and welcome to East Lancashire Hospital's NHS Trust live event on electro-biomedical engineering. My name is Madison Barker and I'm going to help coordinate the event for our presenter, Martin Cottam, who is our Clinical Engineering Operations Manager. This event includes information on EBME careers and an insight into the workshop at Blackburn Hospital. Please type any questions you have into the Q&A box and we will answer at the end of the presentation. Please note this event is being recorded and will be available to view via our education website at a later date. If you have any questions about past or future events, please email us on nhscareers@elht.nhs.uk. I will now hand over to Martin.
Thanks, Madison, and welcome to East Lancashire Hospital's NHS Trust. As Madison says, my name is Martin Cottam. I'm the Operational Manager within Clinical Engineering, or EBME, also known as Electronic and Biomedical Engineering. So this is our third virtual event. Now, in the past, we've invited students as an open day to come round to the workshop and have a look at the equipment that we work on. But under the circumstances, for obvious reasons, the last 3 times have been virtual, as is this one. So again, welcome. How the structure is going to be for this next half hour is that after the introduction, we're going to look at various equipment that we look after within EBME. So basically, within the department, we're responsible for all the medical devices that's used in the trust, from thermometers right up to ventilators and anaesthetic equipment. So we brought a number of pieces of equipment down today for the engineers to show you a bit of what they do, how they work clinically, and what we do as a department to service and maintain them. Now, I've got to say, you'd have thought with all the Zoom and Teams calls that we'd all been perfect in front of a camera, but you'll just bear with us. We're still all quite new to this. So what we're going to do, without further ado, we're going to go to our first engineer, which is Matt, and he's going to describe the process with the defibs. So I'm going to pass you over to Matt now.
So these are 2 of the defibs we use in the trust, and we've recently updated some of the new models. This one is an AED model, like the ones you see in the lock boxes in supermarkets. So this is one that's simple to use for the staff. So basically, the defib
adult mode
just
remove clothing from
generates the
patient's
high
chest.
energy electric shock and
Apply
delivers
pads
it
to the patient's bare chest as shown.
when they're having a cardiac arrest. So
Remove clothing from patient's chest.
turn that off. So that's the AED version, and we've also got a manual version, which is a bit more expensive. So this is used in all the acute wards. So when the defib's in manual mode, the monitor the heart rate of the patient. We use specialized test equipment to simulate pulses from the heart. So we can change that to normal heart rhythm. So you can see on the screen that it's got a normal heart rhythm. And then if simulate a cardiac arrest.
Analyzing now. Do not touch patient.
The defib can analyze the heart rhythm.
Do not
and
touch patient.
tell us if it's a shockable
Press
rhythm
the
or not.
shock button. Shock delivered. Paused. If needed, begin CPR.
Once the shock's delivered, we can measure the energy delivered on the simulator. As engineers, we test these once a year to make sure that the output of the energy is correct, so we don't have any incidents. And that's it. And it's Mr. Billy Rafiq on patient monitoring next.
Hi guys, my name is Billy Rafiq. I'm one of the medical engineers in the department. Today I'll be talking you through spot monitoring, patient monitoring. Now each of the wards has at least 3 to 5 of these, depending on the size of the ward, for spot monitoring. So that gives an indication to the nurse or the HCAs of where the patient is in their clinical pathway. It gives you 3 measurements. So it's your NIBP on the top, which is usually systolic over diastolic. It's got the SpO2, which is the oxygen saturation of the blood. And it also has a pleth, which also is a waveform which displays the information. So I'll set up a demo test using our simulator. So this is a device we use to mimic a patient. It has all the readings you'd want and different parameters and setups. So I'll just set this one up. Also, not to forget, each device comes with 3 different sizes of cuffs. One is your adult, your large adult, and it also has a small adult, because it can be used in pediatric wards. So this mimics a patient's arm, and we'll just set up this, which will take me 2 seconds, and we'll get you some readings on the actual display. Oops. So now if we press start, it should actually produce a BP equivalent to or near enough to 120/80. The outcome of this result will let us know and indicate to us as engineers whether it needs calibrating or not. Good. We usually have an SpO2 simulator as well, but for whatever reason we've not got it on this, so I shall place it on my finger for demonstrating purposes. So that is quite a good outcome, really. So it should be within range. That for us will be passed. 120/80 is what we expected, but we've actually got 123/84. So we will actually pass that. Now it's producing an SpO2, which is within range as well, should be between 95 and 100. Oxygen saturation is measured as a difference between the red light and infrared light to a light detector, which is pushed through the finger, and it detects the oxyhemoglobin in your blood. Right, enough rambling on. I'll pass on to Derek, who shall discuss some ventilators with you. Thank you.
Hi, my name's Derek. I'm one of the senior engineers who are in the department. I specialise up in ITU, which is mainly I do the ventilators and anything else they want to chuck at me. A ventilator, what does it do? You've all seen it on casualty, where you see a patient with a tube in the neck or in the mouth, and they're breathing away, and you'll see something like this sort of waveform. Actually, what it is we're actually inflating the lungs, which you can see by this this bag, which is you see that, yeah, which is simulating the actual gas flow into the patient's lungs. As you can see on the ventilator here, you can see the. There we go. Get a bit closer. Are we all right now? Yeah, you can see the waveforms. We have a peak-to-peak pressure of 31, which is shown on this top line, and we have a flow, which is shown on this line here. We can, and you've got a total of 17 breaths per minute. The unit can be run in several modes, which you can see there. Maybe you can see, I don't know, maybe it's a little bit too small. And this ventilator will actually do anything from the smallest baby you can imagine up until the largest adult you can imagine. So it's quite a flexible machine. This is a special ventilator. This one can be used in the MRI scanner. Now, I don't know if any of you know what MRI is, but it's magnetic resonance. So basically, you push the patient into this. It's a donut, and you push him into this high magnetic field. So this ventilator is mainly made of plastic. There's very few metal parts in it, and the trolley has got a very good brake on it because it will actually take off and disappear into the middle of the MR scanner. That's just a bit of background information. And that's it really, nothing else to talk about. This is, as I say, this is mainly a transport ventilator. We do have large intensive care ventilators, which I tried to get hold of, but we're a little bit busy up in intensive care unit at the moment, so we're struggling to get hold of one. So there we go, on to the next person.
So this is just one example of the infusion devices we use in the trust. We've got several different models that all do different jobs. So the basic function of the syringe driver is just to infuse a drug through a syringe to a patient in a controlled manner. Pumps have different alarms set up as well, so it can monitor the pressure of the drug going through the line into the arm to make sure it doesn't do any tissue damage. We've also got drug error reduction software called guardrails that can stop any user mistakes, so none of the patients get an overdose when it comes to the more hazardous drugs. This particular pump is for patient-controlled pain relief. So when the patients come round from an operation, they can decide if they need pain relief or not. So the clinical staff will put the pain relief medication into the syringe, and then the patient can press the button every time they think they need more pain relief. It'll only infuse a prescribed limit, so they can't overdose themselves. If you look on the inside of this pump, so the infusion pump uses an electronically controlled motor to drive a lead screw, which when the lead screw turns, it moves this plunger head, which is there. And as the plunger head moves along, it squeezes the syringe and infuses the drug to the patient. The other parts you can see are the mains power supply, and there's also a battery backup as well for if they're transferring the patient. And that's about it from the syringe pumps.
We hope you found that useful. We are limited with space in here, so apologies for not having a vast amount of types of equipment we'll look at, but we hopefully it gives you some sort of idea what we do within EBME. So we are called to different environments. We just don't work in the workshop. As Derek said when he was showing you the ventilator, we do go into situations like critical care and operating theatres, but I'll tell you a little bit more about that later on. But now, careers. With different pathways, how we can get into clinical engineering and within EBME, and we've got Joe with us today. Now, Joe's one of our trainees, and thought we'd have a bit of a chat with him on how we got into it and a couple more questions. All right, and Joe, so I wrote the questions down, so we're going to be really professional with this. So Joe, how did you come to work for ELHT and start your career within clinical engineering?
Well, I'm a former student at Millstone College. In my second year of my extended diploma, I was asked to do some work experience, and my tutor came to me and talked to me about medical engineering. To be honest, I've never heard of it and no idea what went on, so I thought I'd give it a go. Spent a week in Blackburn and Burnley hospitals, getting to know the equipment and the staff. I really enjoyed it. Got some good feedback from that. And then a post came up. I applied for it, and due to my work experience and my qualifications, I got the job. I'm really enjoying it.
Good. So what do you like about the job?
Well, like I said, like new equipment's always fun. When there's something else I've not seen before comes in, I get to work on that. That's always enjoyable. And obviously, the vast range of equipment we have in the hospital, I'm always learning pretty much every day.
Right. When I say, what do you find challenging about the job?
Well, sometimes it gets a bit difficult, and I can't always work on it by myself when I need some supervision from one of the team leaders or one of the senior engineers. But I usually get through it.
So we offer you support.
Yeah, of course.
Glad to hear that. So, what's your next steps in your career? I know you're still a trainee now.
Well, I'm in my third year of my apprenticeship now, so it's drawing to a close, and then after that, hopefully I'll go on to my degree and be able to work on pretty much all the equipment in the hospital. And then that should take 3 years from now, and then after that, I'm fully qualified.
That's great.
So, yeah.
Thank you very much.
Thanks a lot.
All right. Thanks, Joe. Right. That's careers with Joe. So as far as careers go, there is different pathways within to get in with an EBME. So whether it's an apprenticeship straight from school, and if that's the case, we usually go to a local engineering outlet where the students will learn basic engineering for the first 12 months, where then they're on site learning with the engineers and the shadow of the engineers, still linking in with the colleges and the training facilitators to make sure that the logs and make sure that the core skills and competencies are up to date. The other pathway is straight from university. You can actually do a degree now in biomedical engineering. So we're fortunate enough, some of our staff have come from that way, where they've come from the universities and come in as junior engineers. Okay, so going back to, I'm going to, if there's any questions, by the way, please feel free to put them in the chat and we'll try and answer what we can. But one of the things I mentioned earlier about the different environments. Now, over the last few months, 18 months, it's become more apparent, more critical with the environments that we're working in, obviously with COVID and the pandemic, in what sorts of areas that we probably weren't used to actually looking at working in prior to all this, the pandemic kicking off. So some of us are trained in using the respirators and we're all competent putting on PPE. So we have been working within the COVID environments, working on equipment on COVID patients, which is challenging, as well as working with something with the PPE equipment on, but also from a well-being and a mental health part, it is quite a stressful aspect of the job, which some of us have found quite difficult at the time. We also work in theatres. Now we like to work in theatres when they're not operating, but there is situations where we're actually in theatre while they're operating. If there's a necessity for one engineer to attend a piece of equipment while they're operating, we do get gowned up and we do work in the theatre under strict protocols while they're operating. Now, what I'm going to do now is I'm just going to see if there are any questions. I don't know if there's any come through, but don't come through.
Hiya, Martin. There has actually one come through.
All right.
And it says, what's an infusion device? So
Right.
what might they be used for?
Right. So the infusion device that Matt was showing you, that's to administer drugs. So there's two different types of infusion device. There's one that actually holds the syringe and it will actually push the contents of the syringe into the patient on a set rate. And there's volumetric, which is obviously the bags of fluid, where it goes through a large volumetric pump and it will administer any doses bigger than a syringe dose. So it is critical when we're servicing them, and we do actually repair them to board level and make sure they are calibrated. We have training, we have technical training by the company, but you've got to bear in mind some of these pumps are actually administering quite toxic and powerful drugs like morphine and things like that. So it is quite crucial and quite critical that when we repair them to a really high standard. Okay, is there anything else come through?
Yeah, there's been another one come through and it says, what does your day look like as an electrobiomedical engineer?
I thought my personal day, don't ask these about my personal day, because you will get all sorts of answers. But from an engineering aspect, yeah, we break the jobs down into two types. There's reactive jobs and there's what's known as planned preventative maintenance, or PPM. So the reactive jobs are the faults that get reported to our department, whether it be from theatres, critical care, or any of the wards or departments, to say a piece of equipment's not working, can we look at it? And obviously we have a database that we have the history of the equipment, so we can look back on and see what any issues that we have with that equipment. We also have the planned preventative maintenance, so that's where we actually look at the equipment, even if there's nothing wrong with it. We try and get around all pieces of equipment within a 12-month period to make sure it's electrically safe, two, that it's function test and it's doing what it should do. Now, like I said, we use a database to obviously keep a track on all the equipment. That database at the moment's carrying equipment of about 11,000 items that we need to keep track on, and that's not just at Blackburn, obviously, but it's at all the 5 hospitals, including Burnley. Now, as far as the team goes, we have a team based here at Blackburn. We have a team based over at Burnley, but for the other hospitals, we just go out as and when they are needed. Okay. Anything else?
Yeah, we've got another one coming.
All
How
right.
long have you worked for the trust?
Right. So I've worked for the trust 36 years. So as far as my career goes, I started this trust when I left school, when I was 16, and I was fortunate enough to get an apprenticeship within the electrical department, and I served my time as an electrician. Now, just as I was coming out my time, this department was it's a relatively new field back then, as electronics was a relatively new field back then. So they started up this with only 2 engineers, and I was fortunate enough to get a junior engineer position. And over the years, I've worked myself up to the operations manager. So yeah, I was trying to say what I'm going to say next, and it's gone completely out of my head. So hope that
Thank you.
helps.
We've got another question. What's the most expensive piece of equipment?
Right, the most expensive piece of equipment, what that we look at, or that the trust owns. I suppose one of the most expensive ones is probably going to be the robot that we have up in our theatres. That run into the millions of pounds. So with the robot, that's there to perform certain operations within theatre, and we're one of the first in the country, well, first in the county, should I say, to actually use this sort of robotic surgery called the Da Vinci robot. It's worth actually YouTubing what it actually does. It's quite a fascinating piece of equipment, but that runs into millions of pounds. Now, unfortunately, we're highly trained specialist engineers, but they won't let us loose on anything that expensive. But we do work on stuff that runs into tens, hundreds of thousands of pounds. The ventilators, they're, how much are they? About £35,000 each. And we've got ultrasound machines, ventilators, and it starts totting up. So the 11,000 items that we've got on our database runs into quite a few £1 million when added together. So it is quite a substantial inventory that we look after within the trust. Any more?
Thank you very much. That's it for the questions coming in so far. But I just wanted to ask a question. Is it a 24-hour service in your department?
No, it's not a 24-hour service. Certainly on the engineering side, we do work Monday to Friday, and we are available out of hours as and when for emergency call out. The other parts of the engineering side, what we have called an equipment library. So what they decided a few years ago was it was make more use of the equipment if we centralised it. So part of EBME, we have our team of equipment library support workers who actually loan out the infusion devices to the trust, to the patients as and when they're required. So half of our department is on the engineering side, and the other side is the medical equipment side, that's medical equipment library, where we loan, clean and document any usage within our departments.
Thank you very much. There's nothing else coming for the time being, but if anybody does have any questions and they don't want to ask them right now, or they think of something afterwards, you can always send us an email on the NHS Careers email address that I've published, and we can always pass them on to the department later on if you do think of something. But thank you.
Yeah, and we'll try and answer any questions we can that get sent to us. So I hope it's been informative. I know it's only half an hour, and it's a little bit, I apologise again for the space, but we've obviously to keep a bit of social distancing still. I hope it's been informative, and we'll see you again sometime. Thank you.
Thank you very much, Martin.
Thank you.